Good morning, everyone. Ladies and gentlemen, distinguished scholar and colleagues. My name is Ani Fitriatul Masuda. I'm from Faculty of Health Science, Universitas Muhammadiyah Ponorogo. Thank you for the opportunity. We can join in 7th Borobudur International Symposium. Today, I'm honored to present our research with the title An Analysis of Shortness of Breath and Survival of COVID-19 Patient. Retrospective Cohort Study from Tertiary Hospital in East Java, Indonesia. Here there are a table of content. The first is background, the second one is method, the third is a result, and the last is conclusion. COVID-19 has posed unpredicted challenge to healthcare system around the world. The disease has resulted in highly global mortality rate. In Indonesia is among the countries with a significant burden in terms of COVID-19 related death. One of the most alarming and clinically important symptoms observed in COVID-19 patients is shortness of breath. Evidence show that patients with developed shortness of breath are more likely to experience self-disease progression and have a higher risk mortality. Given this background, understanding how shortness of breath influences the patient survival is essential for improving clinical management and reduce COVID-19 fatalities. We can see the data in the world as August 2021. There were approximately 198 million confirmed cases and 4 million deaths in worldwide. In Southeast Asia, we can see that on 17 September 2021, there were approximately 11 million cases and 249 million deaths reported across in Asia. We can also see in Indonesia, Indonesia has recorded 6 million confirmed cases of COVID-19 since the epidemic start with 2.45 case fatality rate. And also in East Java, Java is one of the province with the highest number of confirmed case in Indonesia, amount to 19.8 million case, a total of 9.4% nationally as October 30, 2021. The aim of the research is to analyze shortness of breath of survival in COVID-19 patients admitted to tertiary care facility in East Java. This research employed a retrospective cohort design utilizing secondary data extracted from the medical records of Asia General Hospital in Ponorogo. A total case of 1849 confirmed COVID-19 patients hospitalized between March and December 2021 were included. The dependent variable was the final patient outcome categorized as alive and decreased. The key independent variable was the presence of absence of shortness of breath, and we also control for multiple potential confounder, including smoking status, hypertension, heart disease, lung disease, diabetes, kidney disease, chronic liver, oxygen saturation, anosmia, ERDS, acidosis, septic shock, coagulopathy, and convalescent plasma therapy. Survival probability was analyzed using Kaplan-Meier method, and comparison were made use the log-rank test. To identify independent predictor of mortality, we perform univariable, bivariable, and multivariable co-regression analysis using Stata. Okay, this is our results. Our findings show that 67.84% of patients survive, while 32.16% died, indicating a substantial mortality burden. We can also shortness of breath was reported in 53.24% of patients, suggesting that respiratory distress was highly person and may reflect advanced disease severity. Comorbidities such as cardiovascular and metabolic condition were notable. There are heart disease, diabetes mellitus, hypertension, and additionally, 16.42% of patients presented with abnormal oxygen saturation, reinforcing the critical impact of respiratory compromise in hospitalized COVID-19 patients. There is the multivariable co-regression analysis identified several independent predictors of mortality. Most important, shortness of breath. Yes, shortness of breath is significantly increase the risk of a death with a hazard ratio of 1.987, meaning patients experiencing shortness of breath were nearly twice as likely to die compared with those without this symptom. Other significant predictor included heart disease, kidney disease, abnormal oxygen saturation. This result highlight the importance of monitoring respiratory symptom and comorbidities clues upon hospital admission. The next is Kaplan-Meier curve. We can see the Kaplan-Meier curve of survival provide a clear visual representation of survival probability. For the example, we can see on the day 10th of hospitalization, 85% of patients without shortness of breath were still alive, compared to only 60% of those with shortness of breath. The similar trends were seen for smoking, heart disease, kidney disease, and oxygen saturation, where patients with poorer clinical status consistently show lower survival probabilities. This pattern further emphasize the critical role of respiratory symptom and comorbidities in determining patient outcome. In conclusion, our study demonstrates that shortness of breath is a strong and independent predictor of mortality among hospitalized COVID-19 patients. Patients with a shortness of breath had nearly twice the risk of death. Heart disease, kidney disease, and abnormal oxygen saturation were also significant predictor of poor survival. This finding underscores the necessity for early detection, rapid intervention, and careful monitoring of patients presenting with respiratory distress and major comorbidities. Strengthening the clinical practice can great support effort to reduce COVID-19 mortality, particularly in resource-limited setting. Okay, thank you for your attention. Wassalamualaikum warahmatullahi wabarakatuh.